Vital signs. Assemble all necessary armamentarium prior to testing. Blood pressure cuff of appropriate size for the patient, teaching stethoscope, thermometer with sheaths. Adjust chair to place patient in semi-supine position. Inform patient we will be taking their vital signs. Show concern for patient's comfort. Verbally state to evaluator the information to be recorded. Date, arm used for blood pressure, record blood pressure as a fraction, record and label pulse, respirations, and temperature in the patient's chart. Perform proper hand wash and maintain asepsis throughout procedure. Blood pressure. Student has unrestricted access to antecubital fossa and can identify this area. Ask patient to relax the arm chosen at heart level with palm upward. Palpate brachial artery, pulse with index and middle finger. Place cuff 1/2 inch to 1 inch above antecubital fossa and properly align it over the brachial artery. The cuff should not slide or move, but your fingers should fit underneath. Close airlock knob in clockwise direction. Palpate radial pulse with index and middle finger. Pump cuff until radial pulse is no longer felt. Then pump 20 to 30 beyond that point. Release airlock knob 2 to 3 per second and mentally note reading the radial pulse returns. Deflate cuff and wait minimum of 30 seconds. Provide evaluator reasoning for the above series of actions. It is to establish maximum pressure for cuff inflation and the weight allows the blood flow to resume. Position stethoscope over brachial artery, brachial pulse, and re-inflate cuff no more than 20 to 30 beyond previously established maximum pressure. Smoothly release air knob 2 to 3 per second, noting systolic and diastolic reading. Provide evaluator with accurate reading of blood pressure within 4. Complete the process of care for blood pressure cuff and stethoscope. The cuff air knob should be open. Wipe earpiece of stethoscope with alcohol. And the inside of the cuff with disinfectant wipe. Roll the gauge and tubing up inside of cuff and place it inside case. Body temperature. Prepare patient. Inform them of procedure. Provide reason to the evaluator why one must wait and for how long. Hot or cold beverage, wait 15 minutes. Smoking, wait 30 minutes. Place thermometer into a sheath. And place in the proper position in the patient's mouth. Posterior and under patient's tongue. Instruct patient to close lips and breathe through nose. At beep, read and record. Complete the process of care for the thermometer after use. Dispose of sheath. Wipe with disinfectant wipe. Rinse with water and dry. Store in its container. Pulse. Palpate radial pulse using index and middle fingers. Apply light pressure and count the pulse rate for 1 clock minute. You can also count for 30 seconds and multiply by 2. Provide evaluator additional observation you want to make while taking the pulse. Rhythm, volume, and strength.